We're also joined by Dr. Philip Bernard. He's a family physician who specializes in dermatology at the Cleveland Clinic. Good morning, Dr. Bernard.
Good morning, guys.
Okay.
Good to be with you.
It is summer. Oh, well, almost summer. The sun's coming out. I personally put sunscreen on every day. No, it's tinted because I like it, so I don't have to wear as much makeup. But can you share with us why we should be wearing sunscreen? What's going on with the sun?
My pleasure. Well, May is Skin Cancer Awareness Month, so you picked a good time to talk about this. Lots of family vacations going on. I was just down in North Carolina and was in Florida earlier in April. So saw a lot of people coming back to Cleveland, going down from Cleveland. We're all thinking about the sun and getting out in the sun, in the springtime and with the summer coming. I think it's a great topic to talk about. Why should you wear sunscreen? Well, I think, I see a lot of skin cancer in my practice, and most of it is not due to what people are doing now, but it's due to what they did 20, 30, 40 years ago, and it's a cumulative effect. You've got issues that you're dealing with that they may not even be doing anymore. Let's say they use tanning beds throughout college and in their early 20s. And I'm dealing with it now because they're at increased risk for squamous cell and melanoma and the different skin cancers that I'm seeing now. And, it's like you can't go back. The horse is out of the barn. What we have to realize is that ultraviolet light is an issue that is all around us. We don't realize it's there, but you've got basically three types of ultraviolet light that hits your body. You've got or that hits our atmosphere, I should say, from the sun. So you've got the UVC, which is solar radiation, and the people who would be exposed to that would be astronauts because it's a shorter wavelength and it's very destructive to the skin. Our wonderful, God gave us this wonderful atmosphere around us that protects us from that. And our atmosphere absorbs all of that short wavelength that would destroy our skin and cause cancer very quickly. And then you've got UVB radiation, which is 95% blocked by our protective ozone layer. And everyone's been, has for years been talking about, the shrinking of the ozone layer, and it is real. And that's the UVB is kind of like the medium wavelength, meaning that the waves are a little bit longer than the short wavelength. That one is what causes a lot of damage to the superficial epithelial layer of our skin. And as you may know, that layer of the skin is the one that burns. And so that causes most of our sunburns. And that is the main cause of most of the squamous cell carcinomas that we get. When you hear squamous cell carcinoma, basal cell carcinoma, and melanomas, you're usually talking about the superficial layer, which is the squamous cell, and that's the considered like the medium or like the mid-range skin cancer. And then you've got the UVA, which is the third type of ultraviolet light. That one is a longer wavelength of light that causes sun damage to us, and that's about 95% of the radiation exposure that we get. So you've got, but that causes kind of a deeper type of skin damage, and where it happens all the way down to the base layer of the skin, which is where the skin starts before it migrates out to the epithelial layer. And that causes most of the basal cell carcinomas that we get. Wow. And very common. Everybody's had at some point or another, if you're fair, you probably, because skin cancer is the most common cancer that we get in the whole world. And that causes the basal cells. And that's the main cause also of skin browning that becomes like a permanent browning of your skin that happens as you get older. So the UVA causes the most common type of skin cancer. UVB causes the sun damage and the sunburn that we all want to protect ourselves from. And then you've got the tanning beds and stuff like that really increase your chance of the melanomas, which is the moles that become cancerous. We know that's a bad actor.
Yeah. Is there a time frame of, okay, so I'm just kind of like, bopping around, doing some errands. Do I need to be wearing sunscreen then? Or is there you're out 5 minutes versus you're out 30 minutes? When should we be putting sunscreen on?
Well, it really depends on your skin type. If you're very fair, which is the blonde-haired, blue-eyed person who comes from the Nordic countries or England or some of those areas, it may only take you 10 minutes to get a sunburn if you're exposing a lot of your skin. And the way the sunscreens are made, they have different SPF levels, sun protective factor levels, and really the idea is, people are often confused by why do I need to use an SPF 100? Why do I need to use an SPF 50 or a 15? What you want to remember about sun protective factor is if it takes your skin type 10 minutes to get a sunburn, and let's say there's 100 of you, and you're out for 10 minutes, and by 10 minutes, 100% of you will have sunburn, then SPF 15 will lengthen that by 15, so that it'll take 150 minutes for 100% of you to get a sunburn in 10 minutes.
Oh, interesting.
So SPF 30 would be 300 minutes. If you tend to get burned in 10 minutes, it'll take 300 minutes for that to happen. So that it's kind of complicated, but the thing to remember is that most people probably should be wearing either an SPF 15 or an SPF 30. So the other main points I want to make, because our time is always short, is that there are two main types of sunscreen. You have a chemical sunscreen that absorbs radiation. Those are called organic filters. And then you have physical sunscreen or mineral blockers. And, in years past, most of us use the chemical absorption sunscreens. And those are the ones that, they're oftentimes made of benzoic acid. And what we've discovered in years since we started using sunscreen is that there is some systemic absorption that occurs with chemical blockers. So things that have benzophenone, things that have para-aminobenzoic acid tend to be a little controversial nowadays. We try to stay away from them. I'm not saying they're bad. There's been studies that have shown that they have an increased risk of allergic reactions or photocontact dermatitis with them. There's some potential for endocrine system effects from them. And so I think people have been weary of sunscreen in general because of these absorption, because of the way these chemicals work.
Interesting.
We've gotten away from them in the past 10 years, and we've turned more to the physical or mineral blockers, and those are the ones that have titanium oxide and zinc oxide. They don't absorb the radiation close to your body. They reflect it off of your skin. So, and the beauty of the oxides is that they protect you for both the UVA, which I talked about, as well as the UVB, which is the most common type of radiation causing cancer. So, and the FDA has, given their blessings to the physical or mineral blockers now, because they know that they're less controversial than the ones that absorb radiation.
So when we're looking for our sunscreen, we're going to look for a zinc oxide or titanium oxide.
Exactly. Those are the ones that have broad spectrum protection. They cover you for UVA and UVB. So those are the ones. Now, people have been in the past did not really like the physical or mineral blockers because they left like a white film on your skin.
Yeah.
But now they make them with nanoparticles, which micronizes it and makes the mineral blockers much smaller, so that they don't give you that white face appearance when you put it on, and they're very, very safe. So those are ones I would recommend everyone use, unless you really like one of the other ones, that absorb radiation. Now, if you were to use ones that absorb radiation, there are a few that are considered great broad spectrum coverage, and that is the things that contain what are called tinosorbs, Tinosorb. Tinosorbs have a good UVB and UVA protection, whereas a lot of the other ones only really protect you against UVB, not well against UVA, which, as I said before, UVA causes the BCCs, and UVB is just really good for sunburns and also the squamous cell skin cancer. So I know that's a lot to kind of absorb as we're talking about it. Main thing to remember, UVB is the ones that cause the sunburn, and those are the ones that cause a lot of the squamous cell superficial skin cancers. And UVA is the one that causes the basal cells, which damage the deeper area of the skin and cause the skin browning and the discolorations that are hard to get rid of later on in life.
Oh, wonderful. Thank you so much for all that information. I've written it down. I'm going to go check all my sunscreens. I always noticed I would use like zinc oxide for my sons, and they're always like 3 shades lighter. So I totally see that effect. But if it's going to keep them, safer from the sun, I'm going to do that. We're here with Dr. Philip Bernard. He is a family physician specializing in dermatology at the Cleveland Clinic. We've been talking about your summer skin, keeping it safe, protecting it from the sun. But last week we talked about there's this new trend of young girls getting Botox and fillers, trying to keep their skin looking young when they're literally the youngest.
Like 18.
They're already young and they want to look younger, but then they end up looking older. So, Dr. Bernard, we wanted to ask you, what are your thoughts on this? What's going on? Why are they doing this? Are they damaging their skin doing this?
Yeah, this is one of the modern how do I call it? So one of the modern things that's happening in our society today, it's called prejuvenation. It's almost like prepubescent, but instead of going prepubescent, you're going prejuvenation. It's kind of a new word in our lexicon, and I guess I wouldn't be. I was surprised. I really hadn't done a lot of looking into this because I don't see them, those young people coming to me, because at the Cleveland Clinic we have a cosmetic dermatology wing that takes care of a lot of the cosmesis stuff. I just do general dermatology. And so, it was a surprise to me also that this area with the Gen Zers is becoming they're becoming the biggest consumer of injectable cosmetics.
Wow.
Of Botox and fillers. And it's really happened over the past 10 years. And so I was surprised myself. But every year there's been a 50 to 100% increase every year for the past 5 to 7 years of Botox use and filler use among children as young as 12 years old. The entire Gen Z generation seems to be affected by this, and they're saying that it's going to get much greater in the next 5 to 10 years.
Wow.
So it's quite alarming to me.
Because at a young age, your skin is already so elastic and it's going to be stretchy, but then they're adding more things. And is that like stretching it out more than it needs to be?
Yeah. It's not so much the stretching. There's so many layers to this. It's the psychological dependence that happens when you're 12 or 13 or 14 and you think this makes you look really good. So that means you're going to be doing this the rest of your life. Nobody knows what the long-term effects is on young skin.
Yeah.
We see the disaster stories from Hollywood where these people are just over injecting their lips, they're developing a weird plastic face.
They look like deflated balloons.
Yeah.
Yes.
It's very worrisome, but it's really being driven by the amount of time we spend looking at ourselves now. I mean,
That's a great point.
we all read about the Greek the story of Narcissus and narcissism. He started looking at the water, and he just couldn't get away from looking at himself, and till he died because he couldn't go eat and do the things he needed to do. He just stayed there looking at his mirror in the water. And I think that we're dealing with the effects of FaceTime, of the Zoom generation, the TikTok, the pictures that we store in the clouds, the selfies we take, and it just makes us more aware of our imperfections, and it gives people license oftentimes to tell us about our imperfections.
Yeah.
And so it's creating a culture of young people who aren't doing it because they don't want to age. They're doing it because they want to look perfect.
Yeah, that's a great point. I'm looking at myself right now on our live stream. Yeah, I have for sure seen, even just in myself, since COVID, and you start being on Zoom and Teams calls, and you just look at yourself in the bottom box of the Zoom call, and you're not actually looking at people. And I've for sure seen a difference. I started hiding myself on calls, so I'm not looking at myself the whole time. And I can't imagine not just technology in general, what it's doing to, our young people. We already know it's, damaging them and their self-worth, but also now they're getting fillers and Botox to make themselves feel better and look better when they don't need to.
Yeah.
Is there, are there ways to keep our skin looking healthy and young as we age and just in general, so we don't have a need for Botox and fillers?
I think what we have to remember is that the Bible says we're fearfully and wonderfully made.
Yeah.
And it's not just on the outside. I think the temptation then is to focus on the outer you and forget about the you that should be developing in your teenage years, the spiritual you. I think it really is a dangerous thing for that reason. In terms of so you see the psychological dependence on procedures for self-esteem. You see that we divert from the real drivers of premature aging, such as stress. I mean, if you're stressing out about how you look, your body's making more cortisol, which is worsening your insulin resistance and causing destructive effects there. You're using the tanning bed to try to get your lighter skin to look a little darker and healthier. You're not focusing on a balanced diet and regular exercise, which is what you need. You're not using sunscreen consistently and sun protective clothing. You're yo-yo dieting because I gained 10 pounds. I've got to go and starve myself now. We've got to get. We have to look at other things which are still prevalent in our society. Cigarette smoking, that damages the skin and prematurely ages it. Poor sleep and poor sleep hygiene, I think, is another one that damages the skin. And then lastly, the excessive time we spend on looking at iPhones and Android late at night, which is causing us to squint, trying to read those things in the dark in our bedroom, which also affects the crow lines that we're talking about.
Yeah.
So those are all things that we need to be aware of that will, if we focus on those things, we'll be a lot better off. Isaiah 46:4 tells us that even to your old age and gray hairs, I am he who will sustain you. I have made you, and I will carry you, and I will sustain you, and I will rescue you. I think we forget that old age is not a moral failure.
Mm.
It is part of life, and all of us will get there someday if we live that long.
Yeah, that's great. Thanks so much, Dr. Bernard. Dr. Bernard is a family physician specializing in dermatology at the Cleveland Clinic. He's also the chairperson of the Northeast Ohio branch of the Christian Medical and Dental Association. If people wanted to find out more about the Christian Medical and Dental Association, where can they go?
Just go to our site, cmda.org, and please join us. We're growing in Northeastern Ohio. We just had a national convention, and we had 1,000 physicians and allies and medical allies there in Black Mountain, North Carolina. We're just having a great time. Please come join us.
Oh, wonderful. Thanks so much, Dr. Bernard. We'll talk to you next month.